Provisional restoration. The word provisional means established for the time being pending a permanent arrangement, even though a definite restoration may be placed as quickly as possible after tooth preparation, according to GPT-9. It can be divided into biological, mechanical, as well as aesthetic requirements. Indications for high strength provisional restorations. A long span posterior FPD, prolonged treatment time, patient unable to avoid excessive forces on the prosthesis, above average masticatory muscle strength, history of frequent breakage. Aesthetic requirements. The appearance of a provisional restoration is practically important for incisors, canines, and sometimes premolars. The contour, color, translucency, and texture are the key elements of coronal appearance. Contour and color are fundamental and more important than the other two elements. If color and contour are well controlled, most provisional restorations will have a very acceptable and every excellent appearance. Color stability. Discoloration or provisional restoration can be an aesthetic problem, especially when the treatment plan requires long-term provisionalization. PRM are prone to absorption of liquid, so staining can easily produce color changes. Combination of provisional materials, staining solution, and an immersion time are significant factors affecting the color stability. The coffee solution exhibited more staining capacity than the tea solutions. Provisional restorative materials includes the ideal properties of an ideal provisional material has the following characteristics: convenient handling, adequate working time, easy moldability, rapid setting time, biocompatibility, non-toxic, non-allergic, non-exothermic, dimensional stability during solidification, ease of controlling and polishing, adequate strength and abrasion resistance, good appearance, good patient acceptance, ease of adding or repairing, chemical compatibility, and provisional lifting agents. The currently available materials are: these metals shrink during polymerization, which cause marginal discrepancy. Resins currently used are exothermic and are non-entirely compatible. These patients are divided into four resin groups: polymethyl methacrylate, polyethyl methacrylate, polyvinyl ethyl methacrylate, microfill composite, bis-acrylic composite resins, light cure, urethane dimethacrylates. Evaluation. The provisional FPD should be evaluated in the patient's mouth for proximal contacts, contour, surface defects, marginal fit, and occlusion. Deficient proximal contacts, imperfections in contour, or surface defects can be corrected by adding resins using the brush technique. Bis acrylic composites crown. Pro Temp 2. The bis acrylic composite crowns can be used to fabricate a provisional restoration on a quick set plaster cast. Its polymerization produces very little heat and it has minimal toxic effects on soft tissue and the pulp. Fiber reinforced composite processes. Fiber reinforced composites have a good flexure strength. The FRC substructure is translucent and require no opaque masking. The most commonly used fibers are glass, polyethylene, and carbon. Fiber architectures include unidirectional, braided, and woven pattern. All polymer processes compose of an internal glass fiber reinforced composite structure covered by particulate composites. Conclusions. All fields of human activity have been affected by great advances of technological developments, as dentists benefited from these advantages. Today, a wide variety and high quality of the materials are available, but the dentist needs to make the right choice depending upon the technique and condition.